Minister and ladies and gentlemen, my name is Janine Kirk, Chair of Phoenix Australia, Centre for Post-Traumatic Mental Health at the University of Melbourne, and I'd like to welcome you all here this morning to the launch of the new online Australian guidelines for the prevention and treatment of acute stress disorder, post-traumatic stress disorder, and complex post-traumatic stress disorder. May I start off with a little bit of Zoom housekeeping? I would ask that each of you remain muted during this event until you're actually required to speak. Given the virtual nature of this event, I'd like to name and welcome key attendees. Could you each raise your hand when I mention your name? Then the Minister and others on the call will be able to put a face to the name. First, welcome Minister Greg Hunt. Although, Minister, probably you're the only one on this call that does not have to raise your hand to be recognised. We're delighted and privileged that you are here today to launch these important and timely guidelines for the treatment of PTSD. Welcome Professor Duncan Maskell, Vice-Chancellor of the University of Melbourne. Welcome Professor Shataj Kapoor, Dean of the Faculty of Medicine, Dentistry and Health Sciences and Assistant Vice-Chancellor Health, University of Melbourne. Welcome Professor Chris Davey, Head of the Department of Psychiatry at the University of Melbourne. Welcome Professor David Forbes, Director of Phoenix Australia. Welcome Associate Professor Andrea Phelps, Deputy Director of Phoenix Australia, who led the development of the guidelines. In other words, the one who's done all the work. And we'll be hearing from Andrea a bit later. Welcome Professor Derek Sitov from the University of New South Wales and the Chair of the Guideline Development Group. Welcome to Geraint Duggan of the NHMRC. Welcome to Wing Commander Sharon Bowen, Ambassador for Phoenix Australia. Welcome to Mark Rodham, First Assistant Secretary, Mental Health Division, Health Systems Policy and Primary Care, Department of Health. And welcome to other members of the Guidelines Project team and our Phoenix Australia Communications team who are in attendance today. I'd like to start proceedings by acknowledging the traditional owners of the land where each one of us is situated today. We acknowledge that these lands were places of age-old ceremonies of celebration, initiation, and renewal, and that the local Aboriginal people have had and continue to have a unique role in the life of these lands. I'd like to thank all of you for coming together today, and particularly thank Minister Hunt for agreeing to launch the guidelines under these very difficult circumstances. It is very timely that we are speaking today about trauma, post-traumatic stress, or PTSD, and effective treatments. PTSD can occur after someone has been through a traumatic event, and as we all know, Australia has experienced its fair share of disasters over the last 18 months. Drought, bushfires in some areas, floods, and now COVID-19. Each one of these events on their own is stressful and particularly traumatizing. But for those who have experienced them all, the psychological impacts can be very deep and complex. What is needed is clear guidance on effective treatments that will renew lives. Phoenix Australia are the trusted experts in trauma-related mental health and well-being. As the National Centre of Excellence in Post-Traumatic Mental Health, we have taken the initiative, collaborated with trauma experts from around Australia, and developed these innovative living guidelines. This has only been possible due to the generous funding received by the Department of Health, and we are very grateful, Minister, for this support. I'd now like to invite Professor Duncan Maskell, as the Vice-Chancellor of the University of Melbourne, to say a few words and introduce the Minister to launch the guidelines. Professor.
Thank you very much indeed. Good morning, everyone, and thank you for joining me today for this really important event. I really regret that we are not able to convene in person, but it's a really great pleasure to be introducing the launch of such a valuable and important initiative. I would like to thank colleagues at Phoenix Australia and the university more broadly for the extraordinary work that you've done in developing these Australian guidelines for the prevention and treatment of acute stress disorder, post-traumatic stress disorder and complex PTSD. The work you've done on this reflects the core function of our university across the sciences and across other disciplines. That broad function includes gathering rigorous data and communicating clear, factual messages to the public. These guidelines are world-class and will be invaluable for the healthcare profession and people who have endured trauma. I'm also proud of my colleagues at Phoenix for contributing significantly to research and treatment in such an important area as mental health. In light of the events of 2020, with first the bushfires, we thought that was enough, didn't we? And later the COVID-19 crisis, the prevalence and effects of trauma are becoming all the more apparent. And indeed, in such precarious times, I'm gratified knowing that our academics and clinicians are helping to improve the lives of many people who suffer from PTSD. So again, I thank Phoenix for their incredible work. A special thanks to Andrea Phelps for leading the guidelines work, and to Scientia Professor Derek Silove from the University of New South Wales, who led the Guideline Development Group. I'd also like to thank Dr. Ross Lethbridge, Dr. Tracy Varker, and Dr. Kim Jones, who are with us today. And lastly, of course, a very big thanks to the Federal Minister for Health, Mr. Greg Hunt, for joining us today to launch the guidelines. As an ex-alum of Melbourne, as the Minister is, we are always glad to see him back on campus. It's just a pity we can't all be on campus today to welcome him in person. We are very grateful for your support, Minister, and the support from the Department of Health. On that note, I invite Minister Greg Hunt to say a few words.
Look, thanks very much to Duncan, to Professor Kapoor, to Janine, to David, to Andrea, everybody who's played a role in developing these guidelines. The acknowledgement of Indigenous Australia is immensely important, and it's a difficult time. Amongst your number, I've known Ros Lethbridge for probably 25 years, and everybody's been on a journey in the in the last 6 months and beyond for those that have had, as you say, drought. We've had floods, we've had fire, we've had the great history of Australia, unfortunately, coming together in one period, and then coupled with the impacts of a global pandemic. I actually went last week. I was based in the city and was working out of Fort Treasury Place there. And as the city really emptied out, I saw a message on one of the shop fronts, which was weathering the storm, and it really reminded me of that concept of resilience. It's an Australian quality, but it's broader than that. It's a human quality, and it's one of the things which is both innate, but it's also learned. And that idea of weathering the storm, of building that capacity within people to deal with the great challenges of lives, of doing it both collectively and individually, that's so much a part of what we have to do as a society, as a nation, as a community, and then as helping individuals. And it was quite a moment for pause just to see that on the streets, and that sense of grit, and that sense that, yes, this is hard, but everybody, when we say we're all in this together, we really are. So having said that, and acknowledging that, this meeting is in many ways a reflection of the great global challenge of, at the moment, about 13.5 million diagnosed cases and heading towards 600,000 lives lost. Inevitably, it will be that we reach 20 million cases, probably 1 million lives lost, and those are the official figures. And so this is a challenge not like anything we've seen for 100 years, but in a contemporary global community with more means of spread, but more mechanisms for defence and better medical treatment than was the case during the Spanish flu. So having said that, the mental health consequences of, the world in which we live. We're more honest and open about them. We have better diagnoses. Perhaps there are more triggers. So in Australia, at any one time, we'll have 4 million people with some form of mental health condition. Over the course of a normal year, 4 million. That's an immense number of Australians that are likely to have some form of challenge, some form of mental stress and disorder, whether it's anxiety, depression, post-traumatic stress disorder, bipolar, manic depression, or suicidality. And so all of these things come together in eating disorders, so many different pathologies. We're much better at doing two things: acknowledging mental health, and then acknowledging that, like physical health, mental health is not one condition. It's a multiplicity of conditions, and being able to break them down in the same way as we do with physical health is about identifying the individual needs and the individual triggers which we face. So having said that, that brings me to post-traumatic stress disorder. We have perhaps 1.1 million Australians in any one year that are facing post-traumatic stress. And as the name indicates, it follows some sort of external trigger in terms of an event in the vast majority of cases. It could be abuse. It could be a more commonly held experience of drought or flood or fire, some massive personal trauma, which doesn't have to be a physical event, but it can be a set of circumstances. We know that emergency workers, military, police, particularly, are more likely to be exposed to those events, but it could be any person at any time. And I remember Duncan, you mentioned my time at Melbourne University. I remember studying our early cases in torts in first year and looking at nervous shock, as it was called then. Effectively, that's post-traumatic stress. That's the same thing, but it had a long and inglorious history in the law, now much more accurately identified through this work. So that then brings us, knowing that we have a global challenge, that we have a national challenge, to these guidelines, the work of Phoenix, of Janine and David and Andrea, as Janine says, is the real author, with many of the people who are on this call today. And these guidelines, which yes, we've helped fund, I think about $750,000, and that builds on our recognition of Phoenix as a national leader, as a national centre of excellence in post-traumatic stress, with about 1.3 million of funding. But these guidelines are about updating what we know, and then saying we need to recognise and train and treat. Those three things: recognising, training and treating in a way which is appropriate to the circumstances of each individual, because every individual will experience post-traumatic stress in a different way. And by removing the stigma, by destigmatising and offering better treatment, then more people are likely to come forward, and more people are likely to make real progress with their condition. And so these guidelines, which have been supported through NH and MRC funding, which have been supported through NH and MRC approval, are a pathway to better mental health outcomes, better recovery, and better understanding. And so I want to thank everybody involved, and I am delighted to officially launch the post-traumatic stress disorder updated guidelines for Australia at their best. And I believe they are at their best. They will help save lives and protect lives.
Thank you, Minister, for your thoughtful words. Your knowledge of mental health and its impact on the individual, families and communities is really important. And also your knowledge of the issues, I have to say, is very impressive. And also thank you personally and your department for the fantastic support around the ability for Phoenix and the extended family who put these guidelines together to actually complete a document, which I think is going to be so helpful because of its content and its ability as a living document is very helpful. So thank you very much. I now invite Associate Professor Andrea Phelps, who led the development of the guidelines, to talk to us in more detail about the scope and intent of the guidelines. So over to you, Andrea.
Thank you very much, Janine. I'd like to begin by thanking Minister Hunt for his support for the guidelines. Thank you very much, Minister, for being here today and for your support in providing the funding for this initiative. I'd also like to acknowledge Mark Rodham and the support we received from the department, and Grant Duggan from NHMRC for his wise counsel throughout the process. It is a huge undertaking, and we certainly couldn't have done it without all of your support. The Australian Guidelines for the Prevention and Treatment of Acute Stress Disorder, Post-Traumatic Stress Disorder, and the new diagnosis of complex PTSD are intended to guide the care of all Australians who've been impacted by trauma: children, adolescents, adults and older adults, and also across the spectrum from prevention through early intervention and treatment. We know that over 70% of Australians experience trauma at some stage in their lives, whether that be, as the Minister said, from bushfires or other disasters, sexual or physical assault, severe accidents, or exposure through their roles protecting the community, such as police and ambulance, firefighters and military veterans. As a consequence, PTSD is actually the second most common mental health condition, next to depression, in Australia. And 4.4%, or over 1 million Australians, will have PTSD in any 12-month period. It can be a debilitating and chronic disorder, and health practitioners are often unsure of what treatments are most effective. The PTSD guidelines are a vital tool for practitioners who provide care to people affected by trauma, providing guidance on delivering evidence-based treatment that will lead to better outcomes for those people. They're also important for the individuals themselves who are impacted by trauma and their loved ones, who need to know that there are effective treatments for PTSD and they can get better and resume active and productive lives. The guidelines draw upon the highest quality international research and the very important task of translating that research into practical advice for practitioners and for people directly affected by trauma was the work of the Guideline Development Group. This collaborative group included Australia's leading experts in traumatic stress, as well as health professionals from general practice, psychiatry, psychology and social work, who represent the end users of the guidelines. We also had a guideline methodologist as part of the group, who was on hand to ensure that we followed the process laid down by the NHMRC in order to have their approval. And last but certainly not least, we had people with lived experience of PTSD as part of the Guideline Development Group. The breadth of the group membership was really important to ensure that different perspectives were taken into account and that the guideline recommendations would be relevant and applicable in the Australian healthcare context. We were delighted that Professor Derek Silove, who is a highly regarded and internationally recognised leader in the field, agreed to take on the key role of chair of the Guideline Development Group. And thank you, Derek, for doing such a terrific job. I'd also like to mention and thank the Phoenix Project team for their fabulous work in supporting the development of the guidelines. They're here today, as we've said, Doctors Ross Lethbridge, Tracy Barker, Kim Jones and John Cooper. The trauma field is rapidly evolving. New interventions are constantly being developed and tested. Unfortunately, some are claimed as a miracle cure for PTSD before any evidence to support their effectiveness. This means, though, that the evidence underpinning the PTSD guidelines has to be regularly reviewed so that we can be confident that recommendations are always up to date. To allow this to happen, we've built these guidelines as a living guideline, using an online platform that will allow new evidence to be incorporated as it becomes available. The guidelines are available on the Phoenix Australia website. For those who are interested in the details of the research evidence underpinning the guidelines, this is all available through the online platform Magic App. But for those who don't want to delve into the science and just want to access information about the key guideline recommendations, this is presented in easy to download chapters along with important background information. The website also includes specific information about the application of the guidelines for particular groups of Australians and particular trauma types. These chapters have been developed in collaboration with subject matter experts in each field, and we believe that these will be a valuable resource for practitioners. As has been mentioned, the timing of the release of the guidelines is particularly apt, as we're in the midst of a challenging time in Australia's history. It's an important time to be getting the message out to the Australian community about best practice treatment for people affected by trauma, and this is our next focus. As well as seeking the endorsement for the guidelines from the professional colleges for psychiatrists, GPs and psychologists, we're in the process of developing a range of booklets for community members that present the information in the most clear and accessible way. Thanks to the funding from the Department of Health, these will also be freely available for download from the Phoenix Australia website over the coming weeks. Thank you all very much.
Thank you, Andrea, for the overview of the guidelines and for all the hard work of you and your team in putting together this most recent version of the guidelines. And it was a great collaborative project. So again, all those on the line who participated and been engaged, thank you so much for your support and help. And as you said, Andrea, this is very timely that they're actually introduced, if you like, to the marketplace at a very time when they're so badly needed. So thank you. I'd now like to invite Wing Commander Sharon Bowen to tell us a little of her story of diagnosis of PTSD while employed in the RAAF and her recovery following treatment. Sharon.
Thank you, Janine, and thank you, Minister, for being with us here today to launch these guidelines. The Phoenix Australia team, many of whom you see here on our screens today, understand trauma, and in doing so, they renew lives. I must admit there is a fine line between me being their ambassador and, in fact, being their greatest fan. I applaud them for what they do. I'm a registered nurse of 25 years, and I'm also a proud returned service nurse of the Royal Australian Air Force, with active service in Timor-Leste and command in the theatre of war in Afghanistan. So I have studied trauma and cared for survivors of trauma throughout my career, and it has been a great privilege to be able to care for people in their greatest time of need, but also to assist them to continue to live their lives beyond trauma. Because I'm also a survivor of life-threatening trauma. It was the 2nd of June 2004, while serving in East Timor as an aeromedical evacuation nurse, that I was involved in a serious helicopter crash. I sustained multiple injuries, including some serious jaw fractures, aviation fuel burns to my back and shoulders, and a very serious spinal fracture. An injury that robbed me of my health and fitness and threatened to rob me of the career that I loved. And I was just 29 years old. I worked hard to rehabilitate and to rebuild my life despite my injuries. But whilst my body healed, my mind remained at the crash site. Memories replayed in my head, and at night they became nightmares that left me fearing for my life, even though I was in the safety and security of my own home. Sleep was something that I dreaded. Sudden movements and noises startled me, and working on an Air Force base, I became hypervigilant to the sound, sight and movement of aircraft. I could hear aircraft approaching long before anybody else could, and as they flew overhead, I would anxiously await the sound of them crashing into the ground. I feared them. I feared for those that flew in them. I feared pain, and most of all, I lived in fear of fear itself. I had post-traumatic stress disorder. I was told by the psychiatrist that diagnosed me that there were no effective treatments for PTSD and no hope of recovery. He effectively gave me a life sentence. I was fortunate, however, that my GP was much wiser. He didn't know much about PTSD, but he knew a psychologist that did. And under her care and with evidence-based treatment, I began to realise that there was hope of recovery, that there were evidence-based treatments that worked, and perhaps most importantly, that there would be life beyond trauma. She understood trauma and she assisted me to renew my life. But as we've heard, my diagnosis is not rare. Approximately 1.1 million Australians have PTSD at any point in time, but it is vital that they know that effective treatments do exist. It's vital that our practitioners know which treatments have the best evidence and that they receive support to be able to provide them. These high-quality guidelines being launched here today will do this. Phoenix Australia are definitely the leaders in this field. They build the evidence and translate the knowledge into action. They are committed to understanding trauma and to renewing lives. I thank them for what they do, and I thank you, Minister Hunt, for taking the time to understand what they do, and you clearly do. Thank you. I am proud to be the Phoenix Ambassador. Thank you.
Well, Sharon, you might be proud to be our ambassador, but we're proud to have you as an ambassador. Your story is remarkable, but it really emphasised the need and the importance of evidence-based treatment, but also that after trauma, there can be renewal. And I think that's the optimistic message that we really need to get out there. And these guidelines, I think, are really going to help us in showing the way for a whole range of people what that treatment could look like and that renewal is possible. So thank you so much. Minister, ladies and gentlemen, we've come to the formal end of our launch. Thank you also very much for attending the launch today. And again, Minister, thank you so much for finding the time amidst a pandemic, no less, to shine a light on the importance of ensuring that evidence-based treatments are available to everyone in Australia who suffers from PTSD. So we do thank you so much.
Pleasure.